the mindset of the whole education is actually geared to the herbal. For 2,000 years after the Huangdi Nejing being published, acupuncture became treated as second citizen. So all the books, major books, are all herbal. Okay? Which is not very good for us here in the United States, because we use mostly acupuncture. And that is very, very effective. Okay? There's a good thing about herbal, important, but for us, the acupuncture is even more important. So give an example, right? So patient comes in, right, and complain about sleeping problem, the stress, okay, low energy, okay, and get up to pee a lot, right? Common, right? Chronic headache, right? They complain, and then all of a sudden you do an inquiry, the observe, smell, okay, and the post-diagnosis, and then you do a conclusion like insufficiency, dampness, and organ disorder, okay, heart disharmony, okay, and then you start to use the organ, the meridian, 5 elements, try to treat it, right? Okay, so you have this white ball, all these things going through your mind, what's wrong with that, what am I going to do with that? Okay. But most people don't look at the whole picture, okay? Because the whole picture here, for most of the patients, are in pain. You don't see it. People, I see it, okay, but and you start looking at all these other systems. Pain is the center of all people come to see you. So here today, if you kind of get the idea that every time you look at a patient, is what kind of pain, and then I'm successful. Musculoskeletal pain, we kind of talk about, joint pain and muscle pain, right? Okay, it looks like, oh, joint pain, but actually it involves much more. Okay, it's not only you have muscle, tendon, joint pain. Okay, actually, the muscle is the only thing that in the body that actually do the work. So it's actually very, very important for everything that works in the body. Okay, and obviously these are muscle, but they are also the autonomic muscle, smooth muscle. But that's we don't talk about today. That's the only thing we don't talk. Okay. So before that, you had to understand what pain is, right? And pain, what a researcher, scientific researcher, they try to understand that pain, and they would just kind of gravitate to the thing that senses pain. So they have something called pain receptor, nociceptors, okay, and that goes with the sensing for the temperature, sensing for the chemical, sensing for the mechanical stress, okay, and those are things that generate pain signal. But for us, it's not really useful at all, because that's so simple, straightforward. You don't have to. Not much you can do if a person got a pain through a burn. Okay, what can you do? Okay, you can do something to reduce the pain, but acupuncture may not help. Nothing really help except it may numb the person. Okay, so the pain, the science behind the pain is not very helpful for our practice. Okay, and one of the misconceptions is the lactic acid. Okay, you hear a lot when people say, "Oh, I had soreness here and there." They will talk about lactic acid, which is not totally not true. These are proved so many times, but it persists. Okay, the only time you have lactic acid produced is when people have anaerobic exercise, extreme exercise. The muscle doesn't have enough oxygen, So it started to break down the muscle tissue, and they use something anaerobic, not oxygen. Okay. Otherwise, even so, the lactic acid is actually been breaking down to make it as energy too. So that definitely it's not lactic acid. Besides that, there's one thing about lactic acid. If it were true that it caused the pain, then say this person comes in, that there's soreness, that after they walk the mountain, something that had come in and they couldn't move, okay, and say lactic acid. It's a chemical, and you can treat them. The chemical needs to be removed through our body, and it's going to take a long time, okay? So your treatment will have to take a long time, all right? But what happened here, I can give you some example. Like for instance, I have a patient, big guy, and bike riding, right? Overdone, comes in here, I cannot move it. What do? One needle, GB34, and then liver 7 and liver 8. By the way, liver 7, 8 is on the medial side of the knee, okay? 7, 8, okay, those two. And the pain goes away. Okay? So apparently it has nothing to do with lactic acid. All right? And this is very important because next time when patient comes in, say, over weekend, they work too much, they couldn't really move. GB34. Take care of it. Easy. Okay?
Only GB34, or you have to add level 7, level 8?
GB34 is the center.
Center.
Yeah.
Oh, okay.
You don't have to use anything else. If you do anything else, they may be for other purpose. Okay. Okay. So the problem here actually the muscle pain. Why the muscle pain? Okay. People didn't study, look at the muscle when there's a pain associated with the muscle. Find out 3/4 or at least 2/3 of people say they have muscle pain. Has nothing to do with the muscle. It's totally good. Funny, huh? Okay. So next time you say muscle pain, you say nothing wrong with the muscle. Okay. So the pain here is obviously our experience is the muscle pain is the tension. Yes, we all agree, right? Muscle pain comes from tension. Okay, but if you think about it, it's not quite right because see, anytime you use a muscle, you create tension. Yeah, you create tension. There's no pain. So the pain doesn't mean the tension doesn't mean it's painful. Actually, the muscle, the whole purpose of the muscle is to create tension. Okay, so they got it more to that. Okay, so here the more is the persistent muscle tension, meaning that the muscle is tense, but they won't go away and they give away. They don't want to relax, right? And this is what you are essentially look at. They come in here and this muscle too tight. What are you going to do about it? Okay, relax. Breathe in. Okay, meditation or whatever. Okay. And maybe a little bit effective, but not totally. Otherwise, they won't be here, right? Okay. So here we can resolve the muscle tension issue, right? We have to understand that. Before you do that, we have to understand, okay, there are a couple of things. One is a nerve, the role or nerve play. Okay, now, a muscle has three nerves, okay? One is called motor nerve, okay? Motor nerve is the nerve that comes from the spine coming down and then spread into the nerve fiber, motor nerve fiber, got into the muscle, okay? And each, it's called motor neuron, each neuron would control about 4 or 5 muscle fiber, okay? And when you fire this muscle fiber, that same one, those 6, 7, or 8 will contract. All right? Control. So motor neuron is one nerve. The other two, one is called muscle spindle. Okay, and this is to protect the muscle didn't stretch too much. Okay, so here, when you go to the doctor, say, oh, and for the neurological check, they will use a hammer. Okay, check your reflex, because when you hit the tendon, you stretch the muscle very quickly, so the spindle says no, okay, so it contract the muscle. The third one is called, Golgi tendon organ. Okay, Golgi tendon organ, and not many people really are interested in Golgi tendon organ, but this is actually the center of how we are able to relax muscles. Okay. So here there's a couple of reasons people are in pain. Say if they walk a lot, right? For instance, this guy is walk too much, and then his knee is all swelled up. Okay, painful. Okay, and then you will move that the muscle, and it goes away. And this here is one is sprained ankle. Okay, and it happens a lot. People go 1 hour walking, okay, and then they cannot move. Okay. Now here, the very interesting is that I use the SI tendon a lot when people sprain their ankle. Okay, this is for the joint, every part of the joint. So I was in the Myanmar lake walking, and one of the kids riding a bike and got his feet caught in the wheel. So I was crying. So I walked by and just grabbed her hands. Okay, move your ankle. And in seconds, smile. Okay. If you know how to do it, you don't have to wait until you get into this lady's ankle is swollen or whatever. If you do it right there, spine goes away. Okay? If you have to wait on this one here, then you have to do a little bit more. Okay? And one thing will be the calf, liver 7 around area should be very tight, very tender. Okay, and that is related to what I'm going to talk about. Pain creates more pain. Okay? And then there's another one that's called emotional stress. Emotion actually is a big factor on people who have pain, but the pain are real. Okay? They did a test, try to create stress on the healthy body, and they find out they can make their bodies really tense up. Okay, so emotion is part of the creation of pain. So you have, when you treat a patient, you have to address the emotional factor. Okay, don't make them hate you. You have negative. It's a positive and negative. Now you have a big mess in your hand. And this one is particularly this lady here is so-called fibromyalgia. Okay, fibromyalgia, and a lot of people who have fibromyalgia typically started from the emotional stress. Okay, but here, because the pain is on the muscle, so you can treat the same way as we talk about, and they will be effective because we are treating the muscle pain. Okay, so the people who have fibromyalgia, the doctor, oh well, nothing can do about it. Okay, what's the doctor? Because number one, there's no diagnosis to confirm there's something called the fibromyalgia, because there is no test. So it's all based on the patient's presentation. That's pain on the shoulder area, pain in low back, and every place else. Okay, so now you're in pain. So what are you going to do? Not much. You come down here, you treat the neck, shoulder, and low back, and problem is reduced. Continue to do that. And obviously, if you can address the emotional issue, it's even better. Okay? So that's a root of the problem, yes. Okay, it comes to the muscular pain. So you have to somehow, if you can, address the issue. Okay? So here, the whole aim is to relax the persistent contraction of muscle pain. Yes? And how to do that? Okay. How to do that? People try every single way to beat the muscle to right? Deep tissue and the patients. Oh, I feel better. Okay. Yeah, they do feel better, but this is not what we do. This is a different way of releasing pain. The body produces endorphin when you're in pain. Okay, so you feel better after you've been beaten up. Okay, but this is not how I prefer. One side effect of pain is it creates more pain. So that's why if you don't address that and treat it, the problems get worse and worse. Okay, the body is going to change certain ways just to, okay, so. Okay, and couple reasons for that to happen is that, the muscle contraction by what? By shorten the muscle fiber, right? So when shortened, it will become bulky. Okay, and so you're essentially try to stretch the whole muscle on the fascia, so the whole pressure is going to squeeze all the blood flow in there. Okay, so the nerve going through will be squeezed on the side here. So first thing you notice is numbness, okay, and then later on will be maybe turn white or something. Okay, and then it will stop. Okay, tissues start to die. Before they die, they will actually inflamed. Okay, very interesting, right? Inflamed before the tissue die. The most important here is actually when say your muscle pain, right? It's actually because the tension stress spreads throughout the body. Okay. Say I have this patient who is very interesting. She had a cyst, and then bursted, and so have inflamed everything. And then after it's all gone away, still some residual pain. She said when that bursted, she wasn't able to raise her arm. Okay. She wasn't able. She had pain right here. Why? Yeah, people say, oh, this is referral pain. It's not referral pain. And this is related to the pain, breath pain, right? What happened here, and we'll talk about more later on, okay? This is more center, it's called the central pattern generator, okay? Today we'll just talk about the GTO, okay? What happened here is that the central pattern generator in your spine would decide what muscle to use first when you do anything. So this muscle would contract about 50 seconds, 50 seconds, millisecond before it can raise its arm. Okay, and you think about it, right? You raise the arm, you feel this one, this is tight when you do this. So when you have pain here, there will be pain here because you cannot do that. You cannot use this one. Okay, this actually happened to all every single major pain. Okay, they are connected. One pain lead to the other. Okay, all right. So how do you treat people who have shoulder pain? They cannot raise the shoulder. How do you treat them? Acupuncture wise. If they cannot raise it, you do a needle here. Okay? Hurting. And then the stomach to the end. Why is that? Because when you do this, right here, this muscle tight, this muscle tight, this muscle tight. So when you have pain down here, those muscles will be tight, prevent you from doing that. Okay. So it's the patient will be, number one, why do you treat it? Number two, how can it work? Because this is a problem. Body work together. Okay? The whole body is all coordinated by the central pattern generated C. Okay. Now where does the motor nerve situated? The motor nerve actually, you think about motor, it's the nerve that goes in there to excite the muscle, yes? So typically it will be on the belly center of the muscle. Okay? And the muscle spindle, well, spindle is going along with the muscle fiber. So muscle fiber, when stretch too much, they know. Okay. Okay. This shows one of the nerve called the auxiliary nerve, right? Okay. You see that? And the deltoid muscle on the right side, and the nerve got into the muscle. Yes. So this is a motor nerve. Okay. Innervation of the muscle. Okay, so now if you somehow stimulate that area, what's going to happen?
Control.
Yeah, muscle control. Okay. Okay. So why do you want to have muscle contract?
It brings oxygen to the area and then relaxes the muscle. No.
Well, this is a little bit deeper than that. Okay, remember, muscle doesn't do anything; it just follows the nerve, right? So when you excite the motor nerve, this only contract. The more signal, the more contraction until it's spasm. Yes. Where's oxygen coming from? It uses oxygen. You use it if somebody have paralysis or something, the muscle doesn't got exercise. That's when you use that. Okay, so the Ph.D. uses that a lot because when the patient in sport injury do not move the muscle starts to atrophy. So you want to contract to exercise this muscle. All right. But it's not for our purpose to reduce pain. Totally different, right? Makes sense, right?
Yeah.
Okay. Okay. So this is a picture. Okay. On the right side here it shows the spinal, right? Spinal, the nerve. Okay. And in this one here, it actually shows from the spinal going down to the muscle. It shows 3 neurons. These are motor neurons. Okay? And it actually shows you quite interesting, right? Different color, different nerve, right? And each neuron will be, say, for instance, the orange one, and they have 8 or 9 orange dots. These orange dots are the motor neuron. Another one, motor fibers. Okay. There's contracted. Okay. Okay. So each nerve comes in and only control about a handful or 2 handful of fiber. Okay. So in order to maintain a contraction, they actually going going from one motor neuron to another motor neuron. Okay, and this shows on the left side here. Okay, so if you put the sensing electrode, okay, like I have down here, right? Okay, this will sense the electrical pulse on the skin. Okay, you will see a diagram on the top. Okay, so you see, oh, okay, but that actually it's the composition of each individual motor neuron inside there. They are doing all that, okay, and compiled together. When you see it, it's just composite. But each one will have different, okay, contraction. Motor neuron 1, and there's 6 or 7 go in there, and the number of neuron 2, neuron 3, okay, and all set, okay, and between them, the tension of muscle is controlled, okay, and all that had to be monitored, okay. How does your spine know how much which one to send? These are done by the Golgi tendon organ. Okay? So, okay, and this is my own experiment here. Okay, so this is put on the motor neuron. Okay, and then when I contract my muscle, right, and inside there a lot of motor neuron going. Okay, and the composite is on the right side. The graph. A lot of muscle. Okay, and then you stop and go down, and then do again is go up. Okay, so these are all what's going on the motor neurons when you contract muscle. Okay, so as long as you put in the excitation onto the motor neuron, the muscle will contract until it's ran out all the juice. Okay. Okay, and people go, I cannot move that because muscle is all used of energy. Okay, and what are you going to do then? Does that mean really the muscle is used of all energy? Not really, because the Golgi tendon organ send the signal, say, I'm it. Don't do anymore. Okay, that's where you feel tired, exhausted. Okay. But at a time, if you put a electrode there and excited that, it will contract again. Okay, but it might start to destroy your muscle. Okay. Okay, so this is what they use for the motor neuron, motor points. Oh, motor points. Okay. By the way, motor neuron. What's a motor points?
Most sensitive point.
Huh? Yeah, if you learn sports medicine, they would always use motor points.
Yeah.
Why?
Because it controls the most number of muscle fibers.
Because it excites motor fiber. Excited. Okay. So the purpose of that is not to treat the pain. The purpose of that is to exercise the muscle. Exercise muscle. Right? Okay, so you have to be clear about that. Okay, because you learn the sports medicine and then I'm going to treat the pain for this. No, you can't. You make it worse. Okay. 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 When you put a motor neuron, right, from outside, you're going to contract the muscle. That's what happened. Yeah? So essentially you're trying, and this is the patient I have. She was involved in auto accident and she cannot raise the leg. She can't raise it. And the reason she cannot raise it is not because there's something wrong with the leg. It's because of pain in the back there. All the way from back and all the way up here. Okay, so the muscle are not being used. Okay? So I use this, just tone up. Okay? Not for pain, because she doesn't have pain. Okay. Her pain is all along back here. Okay? We know the pain, we have a pain sensors. Okay? But there is no sensor for reducing or nerve that you can inject and then the muscle will relax. Right? If there is worse muscle relaxer, no, that would be so good. We don't have all these problems. We don't have any patient, right? We don't need that. But there is none. Okay, so you have to do it some other way. Okay. So the muscle relaxing can only be done indirectly. Okay? And obviously people, you advise the patient, oh, you could do a relaxation or whatever. What are you trying to do? I mean, why would that even work? Yeah? It works, right? Right? Because mentally when they are relaxed, muscle will relax. Okay, to a certain degree, right? Okay, so that's why you advise them to breathe in. And here is because you want to overcome the tension, mental tension that causes muscle tension. Yeah, so that helps them. Okay, and for anybody who comes in with a muscle problem, they all have mental issue. Yeah, you cannot be happy when you're in pain. Okay, so you help them. Okay, so yes, it can be achieved to relax muscle, but you have to know how to do it. Okay, so let's talk about the GTO, the Golgi tendon organ. Okay, you probably never heard about GTO. Nobody talked about that.